Good afternoon, ladies and gentlemen, and welcome again to the presentation on monkeypox sensitization. Monkeypox sensitization by Dr. Singh. We are glad here today to have him speak on this topic and give us some much valuable information on what we should expect and what to look forward to and the plans going forward. Most of you would have known Dr. Singh from previous presentations, and he's always been very informative on giving us all the information that he himself knows and what we should do and where we should go. So again, welcome, Dr. Singh, and I'll hand it straight over to him so he can do his presentation. Dr. Singh.
Thank you, sister. Good afternoon, ladies and gentlemen. And with me today, Sister June Cumberbatch, Port Health Senior Sister, and Bristol Port Nurse, Sister Michelle Atwell Brathwaite is also with us, and our records officer, Pauletta Clark is also here, along with the IT specialist. Once again, pleasant day. So here we are going for the session. Not is a long presentation, it is very short presentation. So regarding monkeypox sensitization from the Port Health, Ministry of Health and Wellness, greetings from the Ministry of Health. So these objectives, after this presentation, you should be able to understand what is monkeypox, describe the evolving of current monkeypox epidemic, state the possible local impacts of such an infection, outline the recommended responses. Right. Classically, it is a zoonosis endemic to West and Central Africa since 1970s. Animal hosts, mainly rodents and other animals, including monkeys, traditionally from animal to human or limited, family group outbreaks, reporting rate apparently increasing since cessation of smallpox vaccine in 1980s. Exported infected animals caused outbreak in the United States in 2003. Human-to-human outbreaks in USA, UK, Israel, and sea via infected travelers, 2017 to 2019. In 2017 to present, Nigeria outbreak is more than 500 persons. In May 2022, present multi-country outbreak in non-endemic countries. Monkeypox virus. It is an enveloped double-stranded DNA orthopox virus, relatively stable genetically. Two clades, Congo Basin and also West African Basin. Congo Basin causes more severe disease, that is nearly 10.6%, thought to be more transmissible. West African is milder disease, that is 3.6%. So classical monkeypox, stages, incubation period, fever stage, rash stage, recovery. Here we can see the timeline. That is, incubation period is from 5 to 21 days incubation period. It is almost all more than 4 weeks. 4 weeks it will take incubation. Next, it comes to fever stage. Fever stage is nearly 3 to 4 days or 5 days or 1 to 5 days. Rash stage, it takes 2 to 4 weeks. This is very important. Recovery is days to weeks. Sometimes it is very short period, they can recover fast, or sometimes it is a little more time to recover. Clinical findings is anathem, lymphadenopathy near it. So here we can see the 4 stages: macule, papule, vesicle, pustule. We will come back to that next slide, we will see that. And then finally in the recovery stage of the pustule, it will become crusted and healing will take place. Infectivity in the incubation period, nil, and fever stage, very low. But whereas rash stage, that means macular, papule, vesicule, and pustule is very, very high. And recovery stage, once it's crust formed, no pus, nothing. Only scar will be there, no infection at all. So here, monkeypox today. In 7th May in London, a female returned from Nigeria. 14th May, family of 3, no travel or linked to case 1. Then 16th May in London, 4 men who self-identified MSM each other previous cases. On 18th May, London, 2 men MSM via sexual health clinics. On 21st May in London and New South Wales, 11 men, unlike to each other, links to London and Spain. On 23rd May, London, New South Wales and Scotland, 32 men, links to London and Spain. So this is the monkeypox today of the infectious connections in London. What is it? How it is transmitted? What is the transmission? Close contact with the symptomatic, that is with the lesions. That lesions is always after the infectious lesion. With body fluids, respiratory droplets, or contaminated materials such as beddings. Contact with infected animals, transplacental spread, seminal fluid after resolution of lesions. So here you can see monkeypox in skin and soft tissue. In A, you can see the back and pox and rashes in the palm and the foot, and this sole, and also typical finger. And there is specifically it is a pustule of the pox. Then you can see the picture number E. It is crusted is coming out, and the next 3 slides you can see slowly it is disappearing too. Monkeypox multi-country outbreak. In January 1st to 7th of July, 7,892 confirmed cases out of the 3 deaths in 63 member states in 5 WHO regions. 82%, 6,492, 96 cases in 34 countries in the WHO European region. 15%, 1,184 cases in 14 countries in the WHO America region. 2%, 173 cases in 8 countries in the WHO African region. And 1%, 24 cases in 4 countries in the Western Pacific region, and 1%, 15 cases in 3 countries in the Eastern Mediterranean region. Globally, 78% of cases were males aged 18 to 44 years. 7 children less than 18 years of age in countries in the African and European region. 98% of cases identified as men who have sex with men, MSM, of which 41% HIV positive. And also you have to remember that 47% indicated exposure during social events with sexual contact. 113 healthcare workers included, checking if exposure occupational. Non-typical presentation. Few lesions or even a single lesion. No skin lesions in some cases, with anal pain, rectal bleeding. Genital or perineal or perianal area lesions with no spread to rest of the body. Lesions appearing at different stages of development, asynchronous. Lesions before fever, malaise, and other symptomatic symptoms, absence of prodromal period. So now you can see these stages. First stage, small rash is coming, and slowly it is becoming bigger and bigger in the second picture. And third picture, definitely you see that it is becoming, is a pustule, and the last one is becoming, you can see that slowly it is coming down to the crusted stage. So these are all the 4 stages of the lesions. So you can see days from symptoms onset, 5th day, 6th day, 7th day, and 9th day, and 11th day. So this is the stage it starts and comes to an end. Conclusion, monkeypox has likely been spreading globally since 2017. Spread can be accelerated in mass events that facilitate close contacts with multiple persons. So that's why we always stress that spread can be accelerated in mass events that facilitate close contacts with multiple persons. That's why the Ministry of Health and Port Health always, so just giving the sensitization to all the port officers or the other officers and their families, follow protocol always. What is a protocol? What we have to do? So always sanitize your hands frequently or wash your hands frequently, and use mask, always use mask. And also might be, if you could see any person with fever, a headache or body pain, or is lymph gland swelling with a rash, please contact your healthcare institution, call them immediately and say that immediately. Health workers interacting with the infected persons are at risk without standard precautions and the use of appropriate PPE. So that's why that always be during the COVID-19 season, same protocols has been being implemented. And also the same thing we are again and again and again, we are spreading the news. Always use appropriate PPE. We don't know who is coming where from. So in case if you see any person with the signs and symptoms, that means a fever or a headache or a lymph gland with rashes, immediately try to use the PPE immediately. So that will prevent to contact or the spread from any droplet also. That will help you also. And always keep the sanitizers as near as possible to do the sanitizers always. And the non-classical presentation may facilitate non-isolation of infected and infectious persons. Implications, mass gatherings, festivals are possible super spreaders. Risk communication for participants needed. So again and again, we are telling is festivals are possible, the super spreaders. So the risk communication for participants needed. So that's why mass gatherings, whenever the mass gatherings, follow simply the protocols that can prevent everything. Protocols, use always mask, and it is possible minimum 6 feet is a space is important. And also see that if any person has any rash, physical rash, or any other problems, yes, we can immediately help them to contact healthcare institution immediately. That is a great help. Healthcare workers to use standard and proper precautions as warranted. Especially healthcare workers, they know very well during the COVID-19 season, we always sensitize them continuously to use the PPE and other precaution methods. So they are sensitized, so they will follow the healthcare workers. Surveillance, port and inland. In port, assessment of the symptomatic traveler, health alert information. So here in the healthcare workers, especially the port health nurses or Bridgetown port nurses, and are sensitized, what are the signs and symptoms and what they're looking for, and visual looking for any rash or fever or anything, joint pains, body ache, lethargy or malaise. So, and also they can look for any other symptoms the person is going to explain to you. if it is that any person, the travel history, if anybody person is gone different countries and come back, and if they could give you that information, take it as very important note. And the inland index of suspicion for unusual rash, history of determining probable case, simple lesions, isolation, contact tracing. Index case of suspicion for STI rash. STI rash should probably also be tested for monkeypox. Especially in Barbados, the STI healthcare department, doctors, nurses, and all the people were sensitized about the monkeypox. So in case, if anything is there, STI rash, they will do that immediately swab and test as early as possible. So this is the final slide. This is bibliography. These slides are taken by all this, the PAHO, Agani, and also TAG. So these are all the sites you can do that. Also, the slides is prepared by the Ministry of Health, especially Dr. Leslie Rolak, and the team prepared the slides, and they have presented to everyone in the healthcare. And we have taken the same slides and also we are sharing all. So this is from the Ministry of Health, Health. So we are sensitizing. If you have any questions or any clarifications, you can ask us. We are trying to help you as soon as possible. Thank you very much, ladies and gentlemen.
Thank you very much, Dr. Singh. And at the present, we are open for questions. You can either raise your hand and we open for the chat, or you can type in the chat. I know I've asked Dr. Singh this, but I'll ask him again for the benefit of those who didn't get discussion. The previous time, for the regular person outside, the ordinary person outside the medical field, if you suspect a case of monkeypox, whether it's with you or another family member or even a friend, what is your first step? What do you do? Who do you inform? Where do you go from there?
Thank you, sister. Actually, the first, once in the family or any friends, those who are coming to your home or anywhere you meet, if they have a physical rash appearance or the person is having fever or malaise, tired look, or otherwise looking very weak, immediately you can advise the person. Suppose if it is in a home, please ask them to stay in a separate room. That is a kind of isolation room, so that immediately the home other person can call the healthcare institution or a nearest polyclinic, medical officer of health, or the senior health sister, or the principal environmental health officer. Just contact them in the polyclinic and they explain to them this situation. The person has having the physical rash and other signs and symptoms. What we could do? They will ask you to keep the person in a separate room, not exposure with any other persons. Because sometimes the children will be there, or the elderly people will be there. Grandmother, grandfathers, or fathers, or mothers might be. The elderly people will be there at home. So that's why first, separate room. And the team will come and take the swab, and they will take it immediately to the lab, and they will test it, whether it's a monkeypox or not. Once it is a monkeypox, it's a no, and they can move on. But if it's a monkeypox, so immediately the other isolation facility and where the person has to be taken, and then Dr. Coriford and the team, and the Ministry of Health team, CMO, Deputy CMO, the CMO, Dr. George, and Deputy CMO, Dr. Best, and the Senior Medical Officer, Dr. Roland, and other Senior Medical Officer, Dr. Kamaraj. They all can join together and they will decide that this person is going to, based on the signs and symptoms of what is the age factor. They will check everything and they will send them to different designated place. So after 10 days to 12 days, once everything has come down, once the box is completely healed, that means the person is completely healed, so that he will come out. So that is the procedure. So main thing, if you see any person with signs and symptoms, please call immediately your nearest polyclinic or your healthcare worker. Don't take the person straight to them. No, keep them at the home or wherever the place they are, or in the hotel room, they are isolated, the same thing, the same room, and then you can call them so that they will come and help you.
Okay, Dr. Singh, just one more question. What do you think personally about the vaccine? Do you think it's really necessary? I know we don't have the availability here, but is it necessary for us to have the vaccine for this monkeypox?
You know, well, because there is no treatment for the monkeypox except the vaccination. Yes. Even in the South Africa and some other countries, without the vaccination, the healing, the taking the time is very good. So that, but at the same time, we have to be careful because elderly people, some of them are immunocompromised. So those categories, yes, sometimes you can take advice for healthcare workers or for any other person need any vaccination or thing. But currently, it is not available in Barbados, but might be we can expect in near future. If any person need a vaccine for this, always I just tell the other groups also. So yesterday, last week also, I was this morning also just explaining to them. In New York, there is a Chelsea SDA clinic. They are giving the vaccine for the monkeypox. So in case if anybody is going to New York or in any other places, you can visit Chelsea SDA clinic and get vaccination also. Currently, it is not available in Barbados, but at the same time, you can, if it's a infectious stage, no doubt, Dr. Corey Ford and the team of the infectious department, they will take care of you at the designated places with the very highly competent physicians. So no problem at all. We have excellent healthcare. You all know very well during the COVID-19. So we have the excellent facility in the Harrison Point, other places the same way. So they will take the decision where this person is supposed to go. If he's really positive, they will decide it and they can make decision and they will treat them very well. So far, you can see in my slides about nearly 7,800 cases. Only 3 persons died so far. That means it is a good, morbidity is, yes, there and not mortality. So that is very important. Yes.
Okay, Dr. Singh. So if there are no more questions, I want to thank Dr. Singh this afternoon for presenting his sensitization information on monkeypox. Again, it's always been informative, and Dr. Singh is always willing to share information as it comes to him and let us know. And you're reminded that if you have any further questions, you can forward them to me. And if I don't already have the information, I will relay them back to Dr. Singh and he can answer the questions. I thank you again for attending the sessions, and I hope to see you in the future. Thank you and good evening.
Thank you, sister.